High blood pressure is a medical concern that we really address quite often in primary care clinic. Again, the first step in evaluating blood pressure is really having some readings, blood pressure readings, both outside clinic and at the initial clinic visit. If we do find that blood pressure is elevated, and generally a basic guideline is a blood pressure over 140/90, generally that requires, I would recommend a visit to sit down and talk about ways of reducing blood pressure. Oftentimes the initial management is what we call lifestyle changes for a period of maybe 6 months or so. That includes weight loss, and along with weight loss, looking at the diet. Are there ways of reducing dietary sodium? Are there other aspects of the diet that can be changed? And there are other factors that you discuss, we go through as well at the clinic visit, where we talk about blood pressure management. I think alcohol is a factor, diet's a factor. And for folks that whose blood pressure doesn't respond to lifestyle changes, the next step is generally considering medications. It really is something that can be easily managed through one or a combination of medications. It's very important to get our blood pressure under control because of the long-term risk to our health and long-term cardiovascular risk, including the risk of stroke, the risk of kidney damage, and strain to the heart. So it is something that we see a fair number of folks that may come in with high blood pressure, and oftentimes they don't realize their blood pressure has been high until we can look at the outside readings and readings in clinic. And then we can make some good decisions about how we're going to change lifestyle and potentially implement a medication regimen that can get it back under control.